Hi, this is your host of Well-Adjusted Mama, Dr. Laura Brayton, and I'm very excited today to have as a guest on the show Dr. Lorraine Gahles-Kildow. And Dr. Lorraine is a licensed psychologist in New Jersey, specializing in cognitive behavioral therapy as well as applied behavioral analysis. She has helped adults, teenagers, and school-aged children with various issues related to depression, anxiety, OCD, phobias, trauma, PTSD, bereavement and grieving, impulse control, and anger management. Today's podcast will focus on stress and anxiety during pregnancy as well as post-traumatic stress disorder following childbirth. Welcome, Dr. Lorraine.
Thank you, Dr. Laura. It's nice to be here.
I'm so excited to learn more about how emotional stress can impact a woman during all stages of her pregnancy. So let's start with the basics. What is the stress response system?
So the stress response system obviously is activated when we're under stress, and that can be also anxiety or depression in some of the psychological disorders. But it begins to activate then the central nervous system and the peripheral nervous system. And in particular, we have started to see that there is a HPA axis that becomes activated and involved. And what it is the hypothalamic pituitary adrenal axis. And so the hypothalamus picks up those messages. It will then send a message to the pituitary gland, which is our master of our hormonal system. And we will get, and then the pituitary will actually activate the adrenals, and so we're going to get surges of epinephrine, which arouses us and is involved in that alarm reaction, that fight, flight, or freeze response. And then the adrenals are going to be producing some of the hormones, and in particular, the stress hormone that we know a lot about recently is cortisol. So that starts to then be released in the body. And what ends up happening is that's a necessary system that we need when we're in emergencies to fight, flight, or freeze. But when it's activated too much, then we're going to have problems with heart, problems with the musculoskeletal system, problems with the immune system. And so it's important that we learn how to regulate the activation of our stress response system. And we do have ways to be able to do that. So it's important to recognize when we're stressed and that we're activating our physiological system, and then how to put ourselves back into the calming system, which is called the parasympathetic nervous system. So that's basically what the stress response is in terms of physiology.
Mm-hmm. Right, and as a chiropractor, I'm really involved with impacting the nervous system and helping to regulate between that parasympathetic and sympathetic. And, both of us practice in the New York metro area, and I know in my experience I see a lot of that really sympathetic nervous system from people in this chronic fight or flight state, and it's really wreaking a lot of havoc on their system. So the next question I had for you is, how does stress impact a fetus during pregnancy?
So you can imagine we have an idea of how it affects the mother, right? And
right.
What ends up happening is we see that if the mother is experiencing that and she's going into this, activating this HPA axis, right, one of the things that is involved with that HPA axis is hormone called corticotropin-releasing hormone. We may see that also as corticotropin-releasing factor, which is it's actually a family of neuropeptides, but the hormone they're relatively the same thing. So this hormone then becomes released, and what that hormone also does is it regulates the duration of pregnancy and fetal maturation. So what we found is that if you can see, if a woman is experiencing high levels of this corticotropin-releasing hormone, it may be a predictor or a risk factor for early labor and preterm birth.
Mm-hmm. Okay, and how else may that impact the baby after they're born?
So if you are born prematurely, that means that you actually are not totally mature. You haven't reached that full, in utero maturation. Often the lungs are involved when you have a premature baby. And so we actually can save more babies now if they're born prematurely. But we do have to give a certain type of chemical which helps their lungs. But that then can also lead to lung complications. If you're born prematurely, you're going to be at low birth weight, and low birth weight is a risk factor for getting sick, and even in the worst case scenario, mortality, again, depending upon the weight. And then there's been other types of things. We also know that with premature births that there can be some developmental delays. There may be some learning disabilities. And some of those developmental delays, they can catch up in a few years, but of course that involves recognition and detection and early intervention. So there are psychological and physiological complications to prematurity.
And I think you had even mentioned time that like ADHD disorders may be linked as well.
Yes, this was a recent study that I saw, which was very interesting, and it was looked at high antenatal maternal anxiety, and of course it's a correlational study, but what they found was having that high anxiety in the mother was actually correlated with ADHD-type symptoms, externalized behavior, and of course anxiety too. And that seemed to, at least in this study, especially in the early trimester, 12 to 24, well, the early part of pregnancy, 12 to 24 weeks, you would get these externalizing problems. And we also know that in the later trimester, anxiety can actually be correlated with irritability. So you hear that sort of external problems, irritability, feeding problems, sleep problems. So really what's happening is that if you have a dysregulation of your stress response system, it's going to impact, or it can be a risk for impacting a dysregulation in the child's system, right? Because ADHD is about, some of it is about, right, reacting, overreacting, not being able to establish transitions. It's sort of the difficult child in the temperament studies, were the ones that couldn't control their physiological system. So they didn't sleep regularly, they didn't eat regularly, they transitioned well. If they saw a new person, they weren't able to transition with sort of new stimuli. And that's all really about physiological regulation and behavioral regulation. So it seems very likely that this, as I said, dysregulation in the mother and her physiological system is going to be more likely to be correlated with that in the child system.
That makes so much sense. Like if the mother's feeling anxious, that's like an interpretation of not feeling safe, and I could see why her child, even a newborn or infant, would also not feel safe.
Mm-hmm. And if we look at afterbirth, right, so now she's not safe. She feels under threat. She's going to end up with the stress and anxiety. People feel overwhelmed. So that's going to, it's her attachment process too, right? She's not going to be able to calmly trust herself to interact with the child. She may not interact. She might be afraid of interacting. And another thing that I had seen is that it also affects anxiety and stress affects lactation. So you may see a delay in being able to begin to breastfeed, and then think somebody who's under stress and who has anxiety, their interpretation here, sort of the cognitive part, I can't do it. I don't know how to do this. So this is too hard. I might not start breastfeeding. Or if you start breastfeeding and you start to have trouble, and again, think about the musculoskeletal system, where if you're tense and everything, now the baby's going to feel that too, and maybe the baby's not going to latch on properly, and then you don't know how to get to do that, and so you get this reciprocal process of either not beginning to breastfeed or even stopping too early and not continuing it. And, so then it just kind of goes on. It becomes reciprocal.
Yeah, I mean, I think it's even possible that the milk production could just slow down to nothing because of that stress response, and that would lead to early weaning.
Exactly,
yeah.
Yes. And then, of course, if you don't have education or the, sort of the plan ahead of time, this is what I'm going to do, and I'm going to persist, or I'll find somebody who can coach me in this, then you're going to have that, you're right, that early weaning, which is unfortunate because, as we know, the breastfeeding is very healthy for the child and gives them all of those things they need to fight off those early kinds of diseases and colds and things like that in the first, of development.
Yeah, the American Academy of Pediatrics recommends, ideally at least a year nursing. So, under a stressful environment, that could be very difficult to achieve. I also read a study recently that showed that women that had adrenal fatigue prior to becoming pregnant, actually their babies were born with adrenal glands that were hypertrophied because the babies were actually producing additional hormones for the mother to sustain her for the stress response, which is very scary because then how is that child going to develop with adrenal glands that have already been taxed, at the beginning of their life?
Exactly. That really is very scary. And that adrenal fatigue, as you know, that's one of the things that goes into, these autoimmune diseases that we have, especially in this metropolitan area, right? We see a lot of that. The thyroid is involved and, many other things. So that's really frightening. I mean, it's kind of the good news, not the good news about this, but it's very amazing that we are learning more and more about the gene-environment interactions. And so you may have that, let's say, baby that's born with the adrenals not working properly. And usually the functioning of organs, of course, it has to do with structural damage, but it also has to do with the expression. The genes now will turn on and off, right, to make something work or not, the expression of that gene. And but what we find is that we're finding that it can go both ways. And that what happens to us environmentally can just like you said, affect our gene expression and whether something turns on or off or properly. But then the environment can also override some of the genetic predispositions as well. And there's some interesting animal analog studies that have been done with that I'd like to share with you just the two main ones, basically. And one was done, both of them were done with rat pups. And the one study that's sort of a classic study is that lack of maternal licking and grooming. So we can translate that into care and secure attachment type care. It prevented the expression of glucocorticoid receptors. So here we hear that whole stress response system. And of course, those receptors are involved in modulating stress hormones. So now we're thinking even the adrenals, right, are related to that. And when that happens, it makes babies more susceptible to stress. So they have more stress reactivity, if you will, and they're unable to tolerate stress. Okay, so that's the bad news, right? But then the good news is that the environment can affect in a positive way. And this is these classic cross-fostering studies, they're called, where you have these rat pups then who now have the predisposition, that gene for stress reactivity. And if you cross-foster them, in other words, put them with a rat mother who is calm, then those rat pups are able to be calm. So now able to tolerate the stress. So what's really interesting about that, right, is that you can override the genetic predisposition.
Yeah,
change
and that's epigenetics.
Epigenetics.
Yeah.
So change can happen, I think, along the way, right? Because there's this constant reciprocal interaction between genes and environment. We used to just think the gene was it, and if you had that thing, that was that.
Right.
It couldn't be changed. But the environment can change. Genes pretty much set up the trait-like stuff and your predisposition, and then the environment can change that. But the good news is, well, it can change it for the worse, but it could change it also for the better.
Yeah, that's the empowering part here, is that we have like 85 to 90% control of how our genes are expressed. Yes, that's what's so exciting.
Yes. That's really exciting. And it means, I was originally an environmental psychologist, a learning theorist, and I still am. And the one thing I always loved about learning theory was you can change, right? You could set up your environment differently. You could learn something and behave differently. That was always very optimistic to me. And that's true. It's coming out to be true in biology as well. So if you're anxious as a mother, and let's say it does impact your child, you still have a chance to make some changes and to be able to start to learn how to calm your system psychologically, emotionally, behaviorally, environmentally, and then that's also going to influence your child, yourself and your child.
Yeah, so Dr. Lorraine, let's talk about some of these tools that a woman can use to help holistically manage her stress and anxiety.
Okay, so I consider psychological therapy holistic because it's natural, right? It's the natural approach to dealing with all of these things. It's not popping the pill that directly intervenes in a biological way, but you can change the way you think and behave and you perceive. You can change all of those things in order to then adapt better, feel happier, calm your biological system. And so I'm a cognitive behavior therapist. And basically that is you're looking at your thoughts and your thinking styles. You're looking at your emotions and identifying what is that emotion that I'm feeling right now. Some people will say stress, and then you say, well, what's that? What emotion is that? Because stress could be mad, stress could be frustrated, stress could be overwhelmed and anxious, fearful, threat. That can be all different things. So you begin to start to look at that, and you also see how your body reacts too. So, and you see what kind of behaviors you have as a result of all of these things. So when I'm doing therapy, I have people start to detect the cognitive styles, how they're thinking, and not just positive or negative, but what are the types of thinking that really go into engendering an emotional response and then a behavioral response. And so the types of thinking that kind of get us in trouble, if you will, are ones that we all have. And they are those, it's the kind of thinking style that's exaggerated. The psychology calls it, cognitive distortions or irrational thinking. I call it emotional thinking. It's the kind of thinking that goes right along with the emotion. So let's say you're feeling really afraid and you feel a big threat, and I'll say to my clients, okay, so if you're feeling this and you have a panic attack, you have an anxiety attack, and if we look at it, that's the emotion, right? Fear, threat, danger. And if you're only thinking about what the emotion is telling you there's danger there 100% because you also feel 100% threat. But that can be inaccurate, right? Because if you look at it and you can get your kind of rational part back, your frontal lobe back in charge, you'd say, is this really 100%? But if people are emotionally thinking, they'll say to me, yes, because it feels like 100%. Yes, my panic attack feels like it's 100% threat. And I'll say, well, what would be the real event that would cause a reaction in you like this, where you feel 100% threatened and in danger, a real fear versus anxiety? And then I'll say, tell me something that would produce that real fear. Oh, maybe if somebody's pointing a gun in your face and they're about to use. Yes, that's 100, real threat. Now, which one is yours? Where does yours fall along the continuum from 0 to 100? And you usually say, 30, 20. So now they're starting to bring their frontal lobe, their cognitive, rational part into, and they see, oh, so my thinking is that this is 100%, but that's not totally accurate. So every time I get activated into that, let's say panic attack, I have to try to bring my rational part of my mind in and say, no, that's not true. It's totally accurate. and talk back to that. And that's really just very basically what cognitive behavior therapy is. It's getting you to tap into those automatic thoughts. Sometimes they're unconscious, too. Sometimes people will say to me, I don't even have a thought. I just have a feeling and a body reaction. And that's because they're so unconscious and automatic. Well, they're automatic, so they become unconscious, that I have to help them reclaim that and bring it up into consciousness. So that's kind of just the basics of cognitive behavior therapy. I'll have to look at their behavior. Sometimes it's a behavior change. I'll have them look at, how they're perceiving and how they're appraising situations. Lazarus was very famous for talking about the stress response, and he said there's two appraisal systems involved in the stress response. The primary appraisal is, this is a threat. This is a real danger. And then the secondary appraisal is, I don't have the resources to cope with this. And I think that really very adequately describes what happens. So you're intervening, again, as a cognitive behavior therapist. I'm trying to get them to decatastrophize the magnitude of the threat, the primary appraisal, and then I'm usually also working on helping them build up their resources, their coping abilities, active coping, as opposed to usually if we're in a stress response or an anxiety response, we're using avoidance coping. Anxiety and stress wants us to escape and avoid. So that's part of what I do in my work. And usually I would refer out to, if somebody then just was able to utilize the cognitive tools, but they still just wanted to be able to alleviate more some of the physiological distress, or let's came in and they were so overwhelmed that they needed to alleviate the physiological distress before they'd be able to think more rationally, right, use the cognitive. I would refer out, of course, for a medication evaluation. But more recently, I started to do work in an integrative healthcare format, and I started to do work with my sister, who you know, Dr. Nancy Gahles, and we started to refer to each other and do collaborative work. And that's really quite exciting because it really, and it may be, the other part of it is also, sometimes people didn't want to take the medication. They didn't want the side effects. They didn't want, that medication sometimes didn't interact well with them. And so I started to, as I said, refer to my sister, and she would use the homeopathic remedies. And she would start to refer to me, sort of for the same reason we started talking about it, because she would find that the homeopathic remedies would work in calming the system, giving an overall positive uplift, if you will, of the whole system. It's like a systemic response that you get. But they weren't changing how they were thinking and perceiving, and so even though the remedy was working biologically to try to make things different, they kept re-triggering themselves with the thinking and the perception. So the part of the holistic thing that we both use now is working in an integrative format, and it's been quite successful. We started with anxiety cases, and one was a little boy who had, panic, he had OCD, he had separation anxiety, and he would go into these panic attacks at school. And he originally went to my sister for the remedy, but then was referred to me for the cognitive behavioral work and also family cognitive behavioral work. Mm-hmm. And after he started to have both, all of a sudden he just didn't have it anymore.
Yeah.
Now it's a case study, so we don't have, but still you see this overall, not all over the place anymore, which happens, that scattered type of behavior that you have with anxiety, calm, able to kind of really get into the cognitive and behavioral work, but in this calm, positive way. And so I'm very enamored with really utilizing the integrative healthcare approach, and people need to do it more. And especially this would work really well with women who are pregnant, because often they don't take, and they may be experiencing extreme anxiety and extreme stress and can't get that physiological system down with relaxation, which is the thing that I use. I teach them that. And yet they may not want to take the SSRIs, which are the commonly prescribed medicines.
Yeah, I mean, I completely agree that it's really great to bring in different modalities to support someone if they're feeling, acute stress and anxiety. Can you talk a little bit why a pregnant woman might want to avoid taking a prescription medication for stress and anxiety during her pregnancy?
Yes, just from some of the research that I've looked at, the SSRI, it's a medication. Of course, it affects the neurotransmitter levels. We're actually learning more and more about that. It really does affect the other neurotransmitters too. But basically what can happen with the SSRIs and some of the research that I've seen is that, again, there's a correlation between using the SSRIs during pregnancy and the risk factor of having a preterm delivery. There's been some studies that I've seen that looked at use of SSRIs in the third trimester, and then the correlation. Now, this is correlational, but hypertension in newborns, it seems like the risk is, around 1% and below 1%, which that's not a lot, but still, if you're looking at, your child, you may want to, be extra cautious, or you may want to try some of the more natural approaches first.
Yeah.
And so that's what I've seen with that, with the SSRIs. I'm trying to look and see what else. Have you also seen anything on that with the SSRIs?
Yeah, the patients that are coming to my office are already more holistic minded. So a lot of them will come for preconception work, and if they are currently taking like an SSRI, we work with their psychiatrist on getting them, weaning them off of it and literally detoxing it out of their system, but supporting them other modalities. Chiropractic can help very much to get stress out of the nervous system. And there's some other really cool energy modalities that I like to recommend to patients, like EFT or emotional freedom technique, or NET, which is neuro-emotional technique, and a new one that I started practicing in my office, Psych-K, which all of these help with shifting, like limiting beliefs, and really goes back to that when you were talking about what you do with cognitive behavioral therapy, helping people become aware of their subconscious thoughts, and that could be creating the anxiety. And once they're conscious of it, then they can recognize this isn't logical, this isn't realistic, and I can choose a different thought.
Yes. So those are techniques to get to that, which is great. And what I say to my people is, we have to peel off the belief factor. When you have an emotion, when you have a thought, you believe it automatically. And it may be inaccurate. The emotion may just be triggered, and there's not even anything there that's threatening, right? And the thought is triggered too, and it's an inaccurate thought. I can't do this. I'm broken. I'm shattered. I'm unable. So that's not true either. It's inaccurate. So we can have these thoughts and we can have these emotions, but they're not accurate. They're things. And part of the thing when you're in it is to to get out of it and not believe what it's telling you, basically, which isn't so easy to do. But it sounds your techniques also start to look at that and start to bring that. And like you said, when it's subconscious, when it's in the unconscious, you don't even know it's happening. Yeah. And so, that's important to do.
It's so powerful because I've seen people work so hard to make changes and they feel blocked, and it's because of those subconscious thoughts. Yes. And there's even some interesting literature on the post-stress disorder literature where when people are doing the exposure, the prolonged exposure techniques, which have such good treatment outcome and efficacy, but sometimes then they're still not getting rid of the response, to where they want it, in terms of decreasing it.
And what they're starting to look at now is a free association technique, Freudian, very interesting because the behaviorists who are now looking at the Freudian techniques, Freud was right about that, and so that they can actually then, through that free association technique, start to uncover whatever unconscious things are there which are blocking the progress.
Yeah.
It's really quite interesting.
Because these unconscious thoughts are typically formed at very, very early childhood, and that's why it's something we're not even aware of a lot of times as an adult, but it's still it's what drives us, or it can drive us if we allow it.
Yes. It's right, pre-verbal things. Right. Or just a perceptual, and I talk about perceptual, right? If, let's say, after birth, let's say you have somebody who has anxiety or depression and you don't get the type of consistent care that you need, what ends up happening, and this is psychoanalytic, this is from Erik Erikson, right? The very first stage of development is trust versus mistrust. So you begin, the parenting is inconsistent, and you can anticipate, the baby can anticipate that, oh, when I cry, I'm going to be soothed. When I'm hungry, I'm going to get something to eat, and I have this regular pattern, so now I can predict it. Predictability makes us feel safe and secure. Mm-hmm. Then we're going to have a core belief, a core perceptual belief that the world is not fair, right? I can't trust the world. The world's not going to give me what I need. And so we have sort of this basic sense of instability.
Yeah,
and that's really very important. So again, you think about it, it's about the regulation of things, right?
Right.
And predictability and control are two sort of psychological factors that we have to actually gain in order to feel able to handle stress and anxiety. Because when do we get afraid? When we can't predict something or when things out of our control. Mm-hmm. And so we need to be able to get some of that back and know that those are also variables that are going to influence our stress response system as well as our perceptual system.
Yeah. The last thing
go
ahead. Did you have something else to say?
I was going to say something else about, no, go on.
Oh, I just wanted to close with one more question. As a maternity chiropractor, I've seen a handful of women in my practice, follow up after giving birth, and they've had pretty traumatic births in many different ways, and it's created a lot of stress and anxiety for them postpartum related to that childbirth. And I was hoping that you could cover a little bit about that and maybe also how that is helpful with homeopathy.
Okay, so again, so many times what ends up happening is, and now thankfully the DSM-5 now has, first of all, post-traumatic stress disorder and related disorders in a whole separate category outside of the anxiety disorder group. And I really like that because what can happen when we've experienced a traumatic event, no matter what it is that we may not only have an anxiety response, we might have an anger response, or we might have guilt and shame, or we might have depression. And now DSM-5 includes that in their criterion of alterations in cognition and mood. To include that, yes, you could have PTSD, and it doesn't look like anxiety. It looks like something else. But it also can look like anxiety. And the other thing that the DSM-5 has done, which I like, is it also included, they've made the criteria of what is a traumatic event broader. So now we can start to see the hidden faces of post-traumatic stress disorder, which is not just about being in the war and not just about being sexually abused, but something like a birth trauma. And some of the stuff that I've found out about that is that basically if women feel like they have had a negative experience that was unexpected. So anytime you have unexpected, right, dangerous, like, oh my God, something happened and, you know, myself or my baby's life might have been in danger, and or overwhelming, they then can be at risk for developing post-traumatic stress disorder. And some of that is just about what I expected versus how negative that thing was. And that seems to also be correlated with the high use of technology and instruments and, you know, emergency C-sections, or even C-sections, right, that are chosen. Because they may not have been expecting that they were going to feel pain. Sometimes I've heard women say, oh, I'm just going to have this C-section because then I'll know when it's happening and I'll be able to control it and I'm not going to feel as much pain. In reality, they end up feeling a lot of pain. They are really not in control, and they have that sense once they're in that. And, of course, if everything goes well, then it's maybe is not going to be as much of a risk factor. But it seems like the high use of instruments and technology at least set it up. And then if they feel like they don't have support, if they feel like they've gotten inadequate care, and true, if they've had any past history, if they have that anxiety sensitivity, that sets them up to be more likely, just like if they've experienced a traumatic experience in the past, they'd be more set up. But some of those things about how the birthing process goes actually is almost like a precondition or a precursor to setting up the possibility of getting post-traumatic stress disorder.
If a woman experiences obviously, I guess some cognitive behavioral therapy could be very helpful for her.
Yes. And the other thing that I've found, and again, this kind of goes for all disorders, but the other thing that I've become very interested in is the whole movement in positive psychology, and now more and more research is coming out, and basically what that. So you want to do the cognitive behavior therapy to reduce symptoms, right, the pathological symptoms, but you also want to help to build self-efficacy, self-value, psychological resilience for health and healing. And so that's where the positive psychology stuff comes in, because what we actually found, and this is just one classic study by Barbara Fredrickson, who's done a lot of work. She's formed what's called the broaden and build hypothesis, positive emotions. And what she says is, when we experience positive emotions, we broaden our thinking and we build psychological resilience. Now, how do you do that? Think it's just even about, and it seems like optimists have more subjective well-being and are more resilient. And it's because, part of it is because they're thinking, they're strategically cultivating and inducing positive emotions. And so think about one. One is hope, right? That's a positive emotion. You can hear in the word, right? It engenders a broadening out, right? Now you're not just thinking, oh, my God, this is what happened to me. Think about PTSD. Remember that thing. Your memory system repeats over and over again and triggers you into that stress response over and over again. You have routine memories. So you're now thinking in a very narrow way, and you're perceiving in a narrow way. But when you start to cultivate and strategically induce hope, now just the word itself, right, broadens, and you think, oh, wait, there might be something I can do. Or maybe this is temporary and I'm going to get better. Or if I gather my forces, I may be able to handle this, right? You can hear how the cognition and perception is broad. And then you would start positive coping, and you would then be building your psychological resilience. The same thing with love, right? But over and over again with the anxieties and stress, and certainly with the post-traumatic stress disorder, you see in the research it says, and having social support,
yes,
right? Having emotional and social support.
Every new mother needs that.
Everybody needs that. And that was one of the variables in this study I talked about with the PTSD. If they felt like they didn't have the support, the emotional support, either from their husband or their healthcare providers, that's love and support. That builds bonding, right, and helps us feel more resilient. So these are some very, we all know this in a way, but do we strategically cultivate and induce it? And that's part of what I end up trying to help people realize that and start to build that in. It's not just about reducing the problem symptoms. It's also about building the self-efficacy, as I said before, self-esteem, and resilience.
It makes a lot of sense. Well, Dr. Lorraine, thank you so much.
Well, thank you. I've enjoyed talking with you. And hopefully some of the people who listen to this will learn a little bit more and will know kind of what to look for and then ways that they can go about helping themselves heal.
Yeah, I think the bottom line here is that there is hope, and that by getting support and reaching out to professionals specialized in this area, that you can make a shift and that you don't have to suffer and you don't have to be dependent on medication. You can have a different future for yourself and for your child.
Yes, and what that ends up doing is now you're building that in, and so you have to rely on a thing, medication, to do it for you. You've now done that for yourself, and that has maintenance, right? We maintain that learning.
Right.
And so then we can rely on ourselves to heal ourselves.
Yeah, that's wonderful. Mm-hmm. So if people want more information, they can visit your website at Dr. D-O-C-T-O-R, Lorraine, LORRAINE.net. Thank you again.
Okay. All right. Thank you very much.